I'm going to ask you to put your arm in certain positions.
Okay.
I'll let you know right ahead of time. And then I'm going to press in a specific direction.
Okay.
What that does is that isolates just one muscle in your shoulder, so we
okay.
can test the one muscle only to see how it's doing. And then when I push, your job, resist me if you can.
Okay.
And then if there's any discomfort when you're resisting, let me know.
Okay.
So first thing I want you to do is stick it straight out sideways, right? Now I'm going to, you always keep looking forward, right? Everything's squared off here, good. I'm going to push down. Let me know, resist me.
Okay.
Yep, and then let me know if you feel any problems here.
Okay.
Ready? Resist. Okay. Any pain?
No.
No. It's pretty good. Strength-wise, it's pretty good. Now bring it in the front. And again, I'm going to push down. Don't let me. Ready? Resist. Good. Any symptoms? Any discomfort?
No.
Good. Palm up now. Turn the palm all the way up. Now, does that hurt? Or is it tight?
It's just tight.
Now, if you can, keep your elbow locked, right? Hold there. Don't let me push down now. Ready? Push up. Okay. Discomfort?
Slight. Yeah.
Where? Point to where it hurts. Yeah, right in there. That's usually, okay. Now, bring it back here again. I'm going to check some more of the rotator cuffs in the back of the shoulder. Okay. So now I'm going to try to pull forward. Okay. You don't let me, or actually push backwards to resist. Ready? Right. Resist. Good. It's strong. Yeah. Any pain? No pain. Bring it halfway down now. Okay. Again, don't let me. I'm gonna pull forward. Don't let me. Ready? Resist. That's good. Strong. No pain? No pain. Okay. One more I'm gonna do. Bend your elbow. Now, elbow comes up like you're gonna uppercut me under the chin. Okay. Hold it there. Don't let me push your elbow down. Okay. Ready? All right. Here we go. Any pain?
A little bit.
Where? Point to where?
Back here.
Back in there. Okay, so there's a little something going on. No major weakness. Yeah. When you're like this one seemed like the worst one, and I push down. Yeah. That indicates possibly AC joint, which is the joint between the collarbone and then there's a little nub that comes off your shoulder. It's called the acromioclavicular joint. Clavicular is collarbone. The acromion process is a little nub that comes off your shoulder, and they come together and they make a joint. Okay. Right about here. Is that sore?
No.
When I poke? No. Okay. So we're going to do a little work on that later just to make sure it's good. Okay. Now I want you to lay down, face up, and I'm going to check your pec muscle because that also could be related to the shoulder, the front of the pec. So what I want you to do is stick the right arm straight up to the ceiling, right like that. Turn your palm out to the wall. Keep your elbow locked if you can. Don't let me push this way. Okay. Ready? Resist me. Resist. It's nice and strong. Any pain or problems in your shoulders? Okay. Now we're going to do one more. This is for the upper pec where it attaches to the clavicle. Okay. So again, keep your elbow locked. Now I'm going to try to pull your arm like a slot machine towards me on a 45. Okay. Don't let me do it if you can. Ready? Resist. See how that don't want to stay? Yeah. Now, was there pain or you just can't keep it?
A tiny bit of pain here.
You didn't let go from the pain, did you?
No.
So it's also weak.
Okay. Yeah.
Now that's probably the main cause of your shoulder issue. Okay. I see it all the time. Let me check the left side just for comparison. Okay. So bring it up, turn your palm out to this way, keep your elbow locked, don't let me push. Ready? Nice and strong there. Any pain? No. Okay. Now again, elbow locked, and don't let me pull towards me on a 45. Ready? Resist. Oh, see how much stronger that is? Dude, you're a big dude. That should not have gone down that easy. Okay. So there's definitely something turning off the upper pec muscle, and I'm going to figure that out, and we're going to fix it. Okay. And hopefully that's what's giving you your shoulder problems. It's causing some instability in there, which is causing the irritation. Okay. So indirectly it's causing the pain because it's that's a pretty major muscle for your shoulder, and it's weak. Yeah. Right. Okay. Okay. So now sit up. Sit up. Give me a second.
And like I said, the pain came before when I was doing a movement similar to this, and I don't know what happened, but it was really sharp and hurt really bad. And then for a few weeks, I couldn't go higher than this. I would have to do this. Yeah. You know. So shoulder, FYI, is the most complicated joint in the whole body. Wow. It's got the most motion and action. Yeah. It's got the most muscles attached to it. It's the most complicated. So sometimes it's a bitch to figure out what's wrong and treat. But I did a lot of shoulder issues, and I did some postgraduate training in shoulder. So I think the main cause is your upper pec muscle, or what's called the pectoralis clavicular. Okay.
is weak for some reason. We got to figure out why. Sometimes it's because the back is out, because each joint in the back sends nerves out to particular muscles.
Okay.
And that's where it gets the energy from. It's like the circuit breaker for the muscle.
Okay.
And if there's compression, it can turn off the energy to that muscle.
Okay.
So what I'm going to do is I want to test that right now. The pec muscle, you know what? I got to look up a point because I can't remember all the points.
Okay.
So I don't know if you want to cut and edit, but I got to look something up real quick. The Chinese medicine reflex point is the stomach, and then the neurological reflex point is T5 and T6, right about between the shoulder blades. Okay, so what I'm going to do now is I'm going to come back over here, and I'm going to rub those 2 points.
Okay.
Just a little vigorous rubbing for about 10 or 15 seconds.
Okay.
Then we're going to recheck this muscle and see if anything happens.
Okay.
Over the years, I've been doing this for 25, well, I've been doing that technique for about 15 years.
Yeah.
If it's going to help you, what will happen is immediately that muscle will start getting stronger.
Okay.
Okay. So what I want to do now is just take this hand, put it on top of your head for a second. I got to rub underneath here a little bit. I know the ribs are there, and it might be a little ticklish. Don't hit me. Tell me to stop if you can't handle it. Sore?
No.
Okay. Again, the relationship to this and the pec muscle is a Chinese medicine thing. Don't ask me to explain the details. I can, but it'll take 20 minutes. Okay, enough there. Now just rest that down. I'm coming behind you.
Okay.
And now I'm going to rub. First I got to find it. I got to count it. 7 up, 6, 5. So basically right about here. Okay. Just going to vigorously rub the 5 and 6 area of your thoracic spine, just to stimulate the area a little bit with the intent to kind of loosen it up just a little bit, you know?
Okay.
It's not a major treatment. This is kind of like a check to see if we're made the right diagnosis and we got the right treatment point.
Okay.
If it gets stronger, then I'm going to do a good adjustment there, and usually that resets the circuit breaker, and then the muscle works better.
Okay.
How cool is that? I think it's cool.
I love it.
Okay, good. All right, now, on your back again. Go lay down, face up.
Okay.
Okay, stick that right arm straight up to the ceiling. Good. And I'm coming over here. The major pec was strong, so we're just going to check the upper pec. So turn your palm facing me. Keep your elbow locked, remember? And I'm going to pull towards me on a 45. Don't let me.
Okay.
Ready? Go. Okay, you tell the camera. What happened?
It's stronger.
A lot stronger, right?
Yeah.
I didn't even touch the muscle, so relax. All right, no, relax. So that's great.
Okay.
Because when this kind of a response happens, and then we go back and do a really good treatment to that area on your spine, this will really lock in and start firing up better. And then hopefully you won't keep re-injuring your shoulder, and that all that discomfort will go away. Plus, I'm going to give you a shoulder adjustment to get rid of any jamming in there from this problem previously.
Yes.
And that should do a good job in helping that.
Okay.
All right, so sit up again.